I presented this meeting the results of a phase 3 study that has been done in patients having tumors who are ALK positive by FISH testing, already pretreated with crizotinib, that is a reference treatment for ALK positive tumors, and also already pretreated with cytotoxic chemotherapy. So the study was randomized in patients to ceritinib, that is a second-generation ALK inhibitors, against chemotherapy represented by docetaxel or pemetrexed. The vast majority of the patients received docetaxel in the study. Only a minority received pemetrexed. It was a one-by-one randomization, and patients were stratified according to the performance status at the start of the study and the presence or absence of brain metastasis. The primary endpoint of the study was progression-free survival by an independent radiological review. Secondary endpoints were obviously safety as well as overall survival, objective response rate, and duration of response. There was also an assessment for the efficacy of the two treatments against brain metastasis. Patients with brain metastasis at the study entry were more than 50% in each arm. So there was also additional exploratory analysis, including some biomarkers, and the data about this exploratory analysis are not yet available. In terms of primary endpoint, the primary endpoint was met, and the experimental arm of ceritinib was statistically superior to the control arm represented by cytotoxic chemotherapy, and the hazard ratio was highly clinically significant because the hazard ratio was 0.49, and the target hazard ratio, according to the study design, was 0.60, so the real hazard ratio was far below. That is concluding that the ceritinib treatment is a preferred treatment in patients who are already pretreated with crizotinib and with cytotoxic chemotherapy. Coming to the toxicity profile, the toxicity profile was exactly what we were expecting for previous studies with ceritinib, and obviously there was much more gastrointestinal side effects, mainly represented by diarrhea, and nausea and vomiting. There was also a paper toxicity related to an increase in the liver enzyme, in the liver function test. On the other side, in the control arm, mainly due to docetaxel, there was an excess of hematological toxicities. Well, this is another piece of a pretty interesting story. That is a story for a minority of our lung cancer patients, because obviously the ALK positive tumors are only something like between 4 to 6% of our lung cancer patients. But having multiple ALK inhibitors, moving from the first generation to the second generation, we learn how to manage in an optimal way these patients. So now, at the time of failure of crizotinib and after the failure of chemotherapy, that, by the way, it was a sort of second-line treatment. Now we have a chance to use again a targeted therapy, a second-generation targeted therapy that is much more potent in terms of activity than crizotinib, and consequently we are generating another free disease interval of an additional 6 months in these patients, and hopefully we will be able to make this kind of oncogene-addicted type of lung cancer a sort of chronic disease, moving from one treatment to another. Well, there are other studies that will be presented at this meeting, and especially a phase 2 study in patients who were not pretreated with crizotinib, but they only received multiple lines of chemotherapy that up to a few years ago was the standard of care for these patients. And ceritinib in this setting showed a high level of activity in the range of 65–70% response rate, More importantly, the response rate in patients with brain metastases, specifically the response rate in the brain, was in the range of 60%.